Welcome all, myself Harita. We are in FB live discussion at Milann HSR with Dr. Plabani Sarkar, who is a consultant in reproductive medicine and laparoscopic surgery. And today's session is about age and its impact on fertility.
Thank you so much, Harita, for that wonderful welcome. Myself, Dr. Plabani Sarkar, I am consultant in fertility and reproductive medicine specialist at Milann.
So to begin with, doctor, does age have any impact on fertility or chances of getting pregnant?
So, Harita, age is one of the most crucial factors that determines the couple's chances of getting pregnant. In case of females, increase in age is associated with decrease in the number of eggs. The quality of the eggs also falls drastically with age. So to speak of in terms of males, the sperm count, the sperm motility, all these factors, they tend to go down as the age advances. So yes, age is one of the most crucial factors that affects fertility.
Okay, doctor. What is the ideal age for couples to plan for pregnancy?
That's a very good question. There is no ideal age for a couple to get pregnant. If I have to speak in terms of the best age comes with so many factors that need to be taken into consideration, whether it is social, financial, of course the biological part comes into place. So when we talk about fertility, in terms of women, we know very well that after the age of 30 to 35, there is a steep decline in terms of their fertility because of the fall in their egg reserves, because of the fall in the quality of the eggs. We can say that for a woman in the age group of 25, if they are trying to conceive for 3 months continuously, the natural chances are roughly around 20%. Similarly, when the age jumps to 35, it goes down to a level of 10 to 12%. And the same couple, if they are trying and the female is in the age group of 40 to 45, the chances of conceiving naturally is just 5 to 7%. So when we talk about the ideal age, there is no ideal age, but yes, scientifically and biologically, the fertility and the chances of conception are best in the late 20s and the early 30s. But then of course we have to take all other factors into consideration.
Okay, that was a good answer. So how do we extend the time of fertility in women?
So in the last few decades, fertility and the reproductive science has gone a little ahead. Earlier, the procedure of egg freezing or so-called oocyte cryopreservation was considered to be experimental. But now it is widespread available, it has been tested, it has been proved in trials in the scientific literature that it is a very good method that can be provided to women. It was earlier being used for mostly cancer survivors and patients who could not plan pregnancy in their prime youth period. So it came as a good tool for them. But nowadays, taking into consideration that women are getting highly educated, they are putting the careers as their first options and they are delaying marriages, the picture of social freezing has become a little bit wider and more clearer. So egg freezing or egg cryopreservation is one good method where women can put a hold on the biological clock and plan to extend their fertility period.
Okay. How does age affect the process of trying to get pregnant?
Age affecting the process in terms like the younger the woman starts, they have more time to plan pregnancy. If the woman is starting in their late 20s and early 30s, you can try for a natural conception. The concerns of fertility come a little later. But as the age progresses, the chances of conception are going down. Even if a woman is able to conceive, there are so many complications that come into picture. First trimester abortions come into picture, the chances of getting an abnormal fetus, chromosomal abnormalities like aneuploidies, Down syndrome, they come into picture. Medical disorders like hypothyroidism, diabetes in pregnancy, hypertension in pregnancy, all these things tend to rise as the age of the female partner increases. So the process of getting pregnant tends to become more complicated as the age of the couple increases. In terms of males too, like the medical factors seep in. They tend to have, as I mentioned before, low sperm count, decrease in sperm motility, sperm DNA damage increases. So all these take into consideration. We can safely say that as the age is progressing, those complications are also rising. So the process from natural conception to a little bit of help in terms of assisted conception tends to be the norm these days.
Okay, doctor. One of the major concerns women facing nowadays, it's like, I'm in my late 30s, I'm in my early 40s. Am I like too old to get pregnant?
Okay. So the late 30s and early 40s are tricky because of course the quality and the quantity of the gametes, the eggs, the sperm, they are tending to going down. So of course it becomes very difficult, but nevertheless there is no absolute answer to this. Early 30s are the best chances if you do find yourself the time and the social and the financial constraints are not there, and you want to embark on the journey of parenthood. Then yes, that is one time that one can plan, but there is no age where we can say that it is too late. At the age of 40, I would say go for it. We are here to help.
As we are discussing about female when it comes to age, is there any correlation between like male and age when it comes to fertility potential?
Of course, there are studies now that are saying that the environmental factors, the exposure to toxins, pollutions, active smoking, passive smoking, all these things tend to accumulate over a period of time in our body. So for males too, the same thing happens, and the sperm DNA damage tends to increase. And what we have seen is that these sperms with damaged DNA, they, even if they are able to fertilize the eggs and produce babies, there is increased chances of having miscarriages in the first trimester in females. So yes, all these factors can affect male fertility also.
Thank you, doctor. Having from today's discussion, doctor, what we can understand is age is one of the most important factor that affect a couple chances of getting pregnancy.
Yes.
So for more queries, please feel free to contact Milann HSR. Thank you, doctor. Thank you all, and have a wonderful day.
Thank you.